started with our presenters. Today we have two presenters joining us from the CSUCH research team. Dr. Adam Sherk is a scientist with us here at CISUR and a researcher with the World Health Organization and FAHO Collaborating Center on Alcohol and Public Health Policy. His research focuses on alcohol-caused harms, the link between alcohol and cancer, and population-level substance use policy. And he's created techniques for estimating alcohol harms that is used by the World Health Organization. He's contributed to national alcohol systems monitoring in Canada, Australia, the US, and New Zealand, and is one of the co-collaborators on the CSUCH project. So Emily is the second presenter joining us today. Emily is a research and policy analyst at CCSA and a member of the CSUCH Scientific Working Group. Her work focuses on criminal justice harms resulting from substance use and related legislation, and on monitoring trends in the use of drugs from the toxic unregulated supply. Emily holds a master's degree in public health from the University of British Columbia. All right, so let's pop our presenters up here, and I will hand over to Adam to get us started.
Thank you so much, Adam. Thank you, Tina, for the introduction. My name's Emily. I'm really grateful to be joining you from the traditional unceded territory of the Algonquin and Anishinaabe people. Thank you, Tina, for starting us off with that land acknowledgement. I'm really happy to be hear from folks from around the country. So we're here today to talk about the latest update to the Canadian Substance Use Costs and Harms Project, which is CSUCH 2007-2020. Next slide, please. For our time together, I'll start by describing a bit of the history, the objectives of the project, give a little bit of a method overview, and I'll pass it off to Adam to share some of the key trends coming out of this recent report in terms of the costs and harms uniquely attributable to alcohol and the other substances in our study in our time period. We'll, of course, hone in on the highlighting costs and harms of alcohol and end with some alcohol policy considerations. Next slide, please. So to begin to orient our thinking, we wanted to share some of the key findings coming out of the latest update to the project. So in 2020, we found that substance use cost Canada $49 billion. And in terms of some of the harms, led to the loss of over 200 lives each and every day. Alcohol and tobacco, two of our legal substances, accounted for the most costs and harms, but those trends have, for each of these substances, have very clearly diverged. Unsurprisingly, harms due to opioids have risen very clearly in step with the increasingly toxic drug supply. But also costs have actually increased the most for stimulants such as methamphetamine. So we'll break these down in a lot more detail, but next I'll give a bit of an overview of the project. So next slide, please. Okay, so a bit of background. The most recent comprehensive assessment of substance use costs and harms in Canada prior to the CSUCH project was this 2006 report shown on the screen, The Cost of Substance Abuse in Canada in 2002. So this report was quite unique in its time in that it estimated the costs and harms of alcohol, tobacco, and a group of other substances for the year 2002. So this is notable for a couple of reasons. It was really the first or the most recent prior to CSUCH, and it also really laid the foundations for the costing approach that would later be used when the sort of gap in more recent estimates after this report was sort of recognized and work began to provide more updated estimates over a period of years. So next slide, please. Thus began work on the Canadian Substance Use Costs and Harms Project. So starting around 2016, working group got together and has since put out two major releases before the most recent one. looking at costs and harms going back to 2007 and up to 2017. Next slide, please. The scientific working group has continued to work on the project and has come up with a new release. And so this continues to be the work of the scientific working group, which consists of folks from CCSA and the Canadian Institute for Substance Use Research. Our current working group members are listed on the slide here. And we've been lucky to have folks like Adam and a few others on the slide who have been around with the project since its very start. Next slide, please. So in terms of kind of carrying forward the spirit of CSUCH, looking to develop ongoing comprehensive estimates of substance use, our most recent release continues to look at a wide range of substances. So we calculate the costs and harms uniquely attributable to 8 different legal and illegal substances shown on the slide here. For each of these substances, we estimate costs and harms across 4 broad categories. We have healthcare, loss of productivity, criminal justice, and other direct costs. And I'll break these down into their component chapters in a moment. A really important part of the CSUCH project and what contributes to its comprehensiveness is our use of what we call an attributable fraction methodology. And the idea behind this is that some health conditions and events are 100% attributable to substance use. So something like a substance poisoning, a charge for impaired driving, we can identify and count 100% of those towards costs and harms. Others are only partially attributable. So colorectal cancer, as an example, a proportion of which are attributable to alcohol. We also do this for criminal justice, so looking at homicide, other violent non-offenses attributable to substance use. In order to apply this approach, we start by identifying all conditions, events, or indicators that can be attributed to substance use. We look at the relationship between the extent of exposure or level of substance use and that indicator or condition developing. And to do that, we rely on sort of international gold standard evidence to do so. The third piece is identifying the prevalence of exposure or substance use in the population for each of our substances. And this is actually a really important foundation of the project. It's a bit of modeling work that is led by Dr. Jingqi Zhao, based out of CISUR, in which we develop estimates of substance use prevalence from 2006 to 2020 for every province, territory, age group, and sex. So a really important a part of the work we do in this study. And finally, that's combined together to obtain our attributable fractions and get that full picture of the different substance use costs and harms throughout our cost categories. From a broader perspective, beyond just the methods, we really strive to strengthen our approach in a number of ways for this project. It's very much a collaboration of a large and diverse team. As I mentioned, we apply current internationally agreed upon methods in the development of the estimates. We rely on many robust nationally representative data sources where available throughout the different chapters of our study. And there are some examples listed on the slide here. And lastly, this now being the 3rd release in the project, we are mindful to incorporate suggestions and feedback from previous releases as we go along to ensure our work continues to be meaningful and answering the question about how substance use costs and harms change over time in Canada to inform decision-making and resource allocation, so on. So I will give a bit of a breakdown of each of our cost categories and then I'll hand it off to Adam. Our first cost category relates to healthcare. So there are 7 component chapters in this category, which are shown around the slide here. Things like hospitalizations, ED visits, physician time, substance use treatment are some examples. Bolded there is paramedic services, which was a new chapter added to this update. Next slide. Lost productivity costs. There are 3 component chapters here: premature mortality, short and long-term disability. And the idea here is that we're looking to capture how substance use interferes with people's ability to work on a short-term basis, in terms of presenteeism at work and not being as effective at work, or a number of days of work missed. Long-term disability, so number of years or months. And then the most extreme case would be premature mortality. So when people die as a result of substance use related conditions, that contributes to their removal from the workforce and cost associated with what could have been their productivity. Next slide. Criminal justice, 3 component chapters: policing, courts, and corrections. And I'll just point out that, as I mentioned in the attributable fraction slide, we're looking not only at violations of drug legislation like drug possession, possession, trafficking, impaired driving, but also things like violent and nonviolent offenses in each of these chapters. And lastly, a bucket of anything else that we haven't already included in the other categories. So here in the other direct costs, there's a few workplace related costs, research and prevention, and so on, just to round out the picture. So with that, I will hand it off to Adam to take us through the findings.
Thanks so much, Emily. Amazing start to the presentation, and thanks everybody for coming today. On this finding slide, I do like to say that we're a bit lucky in Canada to have a project like this. There aren't really any other examples of such a broad cost and harm study looking at substance use. Today we'll mostly talk about the alcohol findings, but it's across 8 substances as well. So for those, it's 20 chapters that Emily just went through. It's 8 substances, and it's across the full time series of 14 years. There's not really anything else like that looking around globally. So it is important to have this to kind of hinge and inform our policy making in Canada around substance use and health in general. So yeah, just thankful for everybody that was working on the project, both at CCSA and CISUR. I have a couple kind of top line findings from the study here before we start to focus in a little bit more on alcohol. So as Emily said in the key messages, substance use cost Canadian society about $49 billion in 2020. All the dollars presented in throughout the report are in 2020 Canadian dollars, just to kind of hinge that in a real sense. You can see the breakdown there. So that lost productivity chapter, when some of us are removed from the workforce due to substance use, that's coming in at 22.4 billion or 46% of total cost. To hinge that $49 billion on something that is a bit understandable, it's equal to about the entire GDP of a province like Nova Scotia. So every person in Nova Scotia working for the entire year, there's about 1 million people there. Their productive output is about the same as on the other side of the ledger, what substance use costs Canada. So just to kind of hinge the quite large amount that is. To compare provinces and territories, it's sometimes best to do things in per person or per capita costs. And so that's what we have here. This again is for all substances before we start to focus in on alcohol. So you can see that the costs tend to be a bit higher where it is expensive to provision services, so the higher cost in the territories, it's not always driven by like higher rates of substance use. It can also be driven by the other factor that could drive it is the cost of provisioning services in the north. Of course, we all know that's very high. So that's how that breaks out. And the note down there, there are two PTs that couldn't have per person cost calculated, Quebec and Yukon, because they were missing some of the 20 chapters, but it doesn't mean that they're not in the report. Most of the data for the 20 chapters is there. They might just be missing one or two, so it's still quite comprehensive even for them. Now we got to prepare some a special slides for this presentation with a focus on alcohol, since it's for the Cape community of practice. I have 3 slides that are kind of motivating the CSUCH findings. So just to be clear, and I switched the slide background here, this isn't from the CSUCH project itself, but it's a motivator toward those alcohol findings. Just talking about the magnitude of Canada's alcohol supply. So from our administrative sources, for example, Statistics Canada and other sources, there's about just less than 25 million alcohol users in Canada in any given year, more than 14 million non-users. And then so StatsCan provides the magnitude of the supply in liters of pure ethanol, liters of pure alcohol, which is sometimes hard to comprehend. So we switch that over into Canadian standard drinks, and we multiply that by the number of users, this sort of thing. So the total magnitude of the alcohol drug supply, this is from which the harms flow, is the magnitude of the supply. And I'm going to read this whole number just to kind of help us get an understanding of the magnitude. So the total magnitude of the alcohol drug supply is 16,943,733,183 drinks per year. And the point being that it is very high. It's a huge magnitude of supply, and this is from where the harms flow. A slide here. So if we take that total magnitude across all of us, whether or not we're users, and we divide that by the number of users, I wanted to get it down into drinks per week. So it's something that we can kind of think about in a more, as if we're users or know people who are alcohol users. So the magnitude of supply, another way to conceptualize it is it's about 13.3 Canadian standard drinks per drinker per week, or right around 2 drinks per day. And the graph there is you can see how the total magnitude of the supply just continues to increase, over time, with a few drops there, COVID, for example, in 2021, but over time, it's just kind of going up. And I have one more slide to kind of peg it and reinforce the size, the magnitude of the supply. So I wanted to get it into that Canadian standard drinks per drinker per week, the 13.3. And now we have a document that we can compare that to. It's the new guidance, CCSA's guidance on alcohol and health, Canada's guidance on alcohol and health. Right, so there's 2 levels that one could shoot for, or populations of people could shoot for. Let's start with the moderate risk. So even if we wanted to reduce the magnitude of supply to the top range of the moderate risk, which is still a reasonably high added risk from alcohol, this is the bottom number here. So to reduce that 13.3 drinks down to 6, we would need a 57% reduction in the overall magnitude of the alcohol supply. And to get down into the low risk level, which is 2 drinks per week, we need an 85% reduction in the magnitude of supply. So those 2 numbers are one way to conceptualize goals in terms of thinking about the magnitude of the supply. But these again are just they're just motivating, underlying what's going on with the CSUCH results, which is about harms and costs. Now moving into back to the CSUCH findings, and you'll notice the slide background change. So now into the CSUCH results, as Emily again said in the key messages, when we put those substances across, we see that alcohol and tobacco count for the highest cost between them, about 63% of the total cost of substance use in Canada in 2020. And you can see that the third most costly substance is opioids, and that, you know, it's been closing the gap with tobacco, so to say, unfortunately. This is another really key point that was in the key messages. So if we look at those top two lines, now we're seeing the power of the time series, the 14-year time series, where we can look at how the costs and harms have changed over time, and look at how though the cost per, this is cost per person caused by the substance in question. Look at how alcohol and tobacco have diverged. So back in 2007, they were quite close together. They caused around the same amount of cost in Canada, but look how alcohol has continued to rise, and tobacco, you know, the one success story among these 8 substances, look how it's dropped in a per person cost over time. And now we have this very significant divergence between alcohol and tobacco, where alcohol is responsible for nearly twice as much cost as tobacco is. You know, and you can kind of reflect on just seeing one question in the chat. Yeah, so I'll just reiterate that everything in this is in 2020 Canadian dollars. So they're all in real terms. They've all been adjusted to inflation. Yeah, so the real divergence between alcohol and tobacco over time, and we can kind of think about, since this is a policy group, why that might be. You know, the treatment of those two substances has been so different from a policy standpoint. Now, yeah, this was cost, but now this slide is talking about years of life lost, and that can tell a bit of a different story, because this is about when people are, from the different substances, when people are taken from us in their life course. So something like tobacco, it causes an immense amount of death and disability, but that death and disability tends to happen on average later in the life course. Whereas something like with opioids, with overdose, and it's so immediate, these things tend to happen on average when people are younger. And so thinking about it in terms of years of life lost, opioids and alcohol kind of go toward, you see they're higher there compared to the other substances. And so that's a different metric that we look at. And this underpins the economic loss of production section, because we're curious about how many years of productive life are lost from death and disability due to the different substances. Alcohol and just behind it, tobacco are responsible for the most hospital stays, overnight hospital stays. So alcohol caused, and here's the number, about 118,000 overnight stays. And this was at a cost, this is in all of Canada, 1.63 billion 2020 Canadian dollars. And tobacco just behind. And you can see that these, you know, in terms of the overnight hospital stays, these really dwarf the other substances in terms of, you know, getting admitted in the hospital to stay overnight because of the conditions, the health conditions that are caused, cancer and so on, by those two legal substances. This is that same slide, but it breaks each bar down into the type of health condition that caused the hospital stay. And so it's important to note that if we look at the alcohol, that pink part of the bar, that's unintentional injuries. So about just over 50% of alcohol caused overnight hospital stays were for unintentional injuries. You know, so there's that acute part of alcohol use, injuries and collisions, and then there's the chronic part driven by cancer and heart disease and stroke. Another type of hospital visit is emergency department visits. So alcohol here, because of the nature of particularly acute things that alcohol is implicated in, very high, a lot higher than tobacco now here. So we're seeing about alcohol causing over 650,000 emergency department visits every year in Canada at a cost of nearly $250 million. And in terms of criminal justice, again, alcohol sorts to the top. So Emily was describing some of the underlying methodology for this. This is kind of quite unique component of the CSUCH study. So this is criminal justice cost in billions of dollars. About $4 billion in criminal justice costs were caused by alcohol in 2020. And then you can see each bar with cocaine ranking second there at $2.4 billion. You can see each bar within the big bar, the colors, to separate the types of events: violent, non-violent, drug violations, and impaired driving. Yeah, and then I put this slide for alcohol. So like the screenshot from the left is from the report. So we can always go to the report to get more information on alcohol and all the substances. But I wanted to rank, like, among those 20 chapters that are grouped within those 4 sections, wanted to rank where the highest cost comes from alcohol. So if we do that, the one that comes to the top is the lost productivity that occurs because of death. So that's 4.6 billion, or that's in million, but I'll say it in billions. And then the second one, actually, I was surprised when I made this. The second one is the policing cost. There's quite a substantial criminal justice cost, particularly around policing that alcohol is responsible for. So over $2 billion, again, across the whole of Canada. And then 2 healthcare chapters, the physician costs and prescription drugs. And fifthly, I just did the top 5 is short-term disability. So that's within the lost productivity section, but looking at the short-term disability chapter. So I was actually surprised that hospital stays, overnight hospital stays, weren't on this top 5 list, but it would be 6, looking at the thing over on the left that has all the costs. So we'll briefly, and then we'll have lots of time for discussion as well. We'll just talk about a summary and policy considerations regarding what we've seen in terms of the CSUCH findings about alcohol and in the broader substance use context. Those key messages again, so substance use costs nearly $50 billion, and maybe more importantly, leads to the loss of over 200 lives every day. Alcohol and tobacco, our 2 biggest legal substances, account for the most cost and harms, about just less than 2/3 of all, let's say, cost caused by substance use. And importantly, there's really clear divergence in alcohol and tobacco costs. And we could maybe suspect that these are at least partially due to the different policy and regulatory treatment of those 2 substances, which we can imagine. So in terms of policy considerations with a focus on alcohol for this presentation, reduce the harms of alcohol use by applying lessons learned from Canada's public health response to tobacco, labeling, using this new document from CCSA, Canada's guidance on alcohol and health, more than we have in the past, and really kind of leading on that. And in a broad policy strategy way, consider implementing coordinated policy strategies toward reducing the magnitude of Canada's alcohol supply, while at the same time supporting people who are currently dependent. So this would involve staged and stepwise deployment of a suite of evidence-based alcohol policies, such as, I mean, this is the CAPE community of practice. So if you've been coming to these presentations, as people talk more about CAPE, kind of know what the potential policies are that are in our arsenal for deployment. Health and warning labeling, harm reduction services, availability and advertising restrictions, and pricing and taxation, like, for example, minimum unit pricing. So CAPE, has just done such good work. Again, kind of a world leader in that for Canada in terms of alcohol policy. And the next step, so CSUCH is kind of ongoing. We've been working on it since 2016. And as Emily said, this is the third iteration, getting that longer time series and harmonizing methods across the entire time series for all those provinces and territories and substance types. So in the medium to long term, we'll continue to update with new years of data, cost types, and enhanced methodology. We're always talking about this. And I'll just mention, if you don't know about it, there's a really wonderful online data visualization tool that you can go to. And a lot of the slides that were done that were alcohol specific, I just created them in the tool. Like, it's just that's even where we go as people that work on the project. The tool is really well done. And it can really break out a lot of different things by province, territory, all the years and substances and types of costs. So if you're interested in that, you can check it out more.